Hi, good afternoon. My name is Natalie Villegas, and so today I will be performing the return demonstration for vital signs taking. Now, what is vital signs? Vital signs are body temperature, pulse, respiration, and blood pressure. Now, it is recently, like many agencies, have designated pain as the fifth vital sign. So, to be assessed at the same time at each of the other four. Now, these signs, which should be looked at in total, are checked to monitor the functions of the body. Now, the signs reflect changes in function that otherwise may not be observed. Now, monitoring a client's vital signs should not be an automatic or routine procedure. It should be a thoughtful and scientific assessment. But before we continue, I will show you the equipment that we will be using in taking the vital signs for the patient. Now for the T, which means temperature, or it is the body heat, the equipment that we will be using is the digital thermometer. And then P is for the pulse. So what we are or what we'll be using in taking the pulse is it could be the stethoscope or your two fingers, the index finger and the middle finger, and R, which is the respiration, is you also have to use your hands or this two hand in order to know the rhythm, and also you have to listen for the sound of the breathing of the patient. And for the pulse is no, sorry, for the respiration, so that's it. And for the blood pressure is you will use this one, the sphygmomanometer, and also the stethoscope. So that's it. Okay, but before we start the procedure or the assessment, is we have to do the disinfection. So first is, as a nurse, we have to make sure that we are not we are not transmitting any infection or bacteria to our patients. So it is best to use alcohol. So you have to disinfect first with the alcohol, and then with the use of your cotton ball and your alcohol, you have also to disinfect the thermometer, and that is from, so let's just pretend that this is a cotton ball. So you have to disinfect from the head of the thermometer to the tip of the thermometer. Now, the reason why we have to prepare the equipment first before doing the procedure, it is to save the time and energy. Now, before taking the temperature of the patient, you have to introduce yourself first and also verify the client's or the person's identity. Now, the rationale for this is to create a rapport and also to prevent medication error. So how do you know, or how would you know the name of the patient? Now, in a hospital setting, you will see the names on the bedside of the patient, but maybe some hospitals doesn't have that, so you have to refer to the patient's chart. So from there, ask the patient's name. So don't provide the name of the patient. Ask them first if what is their name. Hi, ma'am. What is? Can I please have your name?
I'm Ashley Chepe.
Ashley Chebet. And how old are you, ma'am?
I'm 20.
20. So when the patient will tell you her name and her age, you have to check it on the patient's chart. So it says there, for example, this is the patient chart. So it will show Ashley Chebet and then her age. So we just verified the client's identity. So it is to prevent medication error. Now next is you have to explain what you're going to do and why it is necessary. Now the reason why we are providing, information, or the reason why we are providing or vital signs taking from the patient is to make the patient aware and comfortable in providing the information so that they will also cooperate during the assessment. So, ma'am, so now what we're going to do is we're going to take your temperature.
Yeah.
Is that okay?
Yes.
The reason why we're taking your temperature is to check if you're having a fever, or you because earlier you mentioned that you're not feeling well, so we'll check if you have a fever. Okay.
Oh, okay.
So you have to, because we're using the digital thermometer, you have to turn it on, and then because earlier we already did the hand hygiene, right? And also don't forget to provide client's privacy. Now it is very important to provide client privacy. It's because, to make the patient feel comfortable and provide respect towards the patient. So even though they are inside the hospital, or asking, asking care from us, nurse professional, it doesn't matter their status, or whether because they're patient, we still have to provide privacy. So place the client in the appropriate position. So it is to provide an easy access to the axilla. Now axilla is the armpit, the jargon. So this is the arm of the patient, and then this is the patient's axilla. So ma'am, let me put the thermometer. Now you have to wait for 1 minute, or up until the thermometer beeps. So, okay, now the reason why we're taking vital signs on the axilla, it is to prevent interference of the measurement. Now the axilla, or like we have to pat the axilla, right, and make sure that it is dry before we provide or before we take the temperature of that part of the body. So as I mentioned earlier, place the bulb in the center of the axilla. So that's what we are doing. Okay, ma'am, so your temperature is 36.2. And so now after taking the temperature of the patient, you have to make sure to disinfect the thermometer first before putting it back to its container. Now, in order to clean the thermometer, and again, wipe it from here up into the bulb of the thermometer, and then you have to discard the cover, or the wipes that you are using, or the tissue if necessary, and then you place it back. And you also have to, it is very important to document the temperature of the patient on the patient's chart. Now the rationale why we have to document the temperature of the patient after getting, his or her temperature, it is for easy retrieval, and it provides an ongoing data collection. Now next is we'll be taking the pulse of the patient. So that is the second of the TPR and BP. Now pulse is a bounding of blood flow in an artery that is palpable at various points of the body. Now it is a wave of blood created by contraction of the left ventricle of the heart. So a pulse is commonly assessed by palpation or auscultation, and the middle three fingers are the ones that we use for palpating all pulses sites except for the apex of the heart. Now a stethoscope is used for assessing apical pulse. Peripheral pulse is a pulse located from the heart, for example, the foot and the wrist. Now, an apical pulse, or the point of maximal pulse, or PMI, is a central pulse located at the apex of the heart. So there are different heart rates. There are four of them, which is tachycardia, which is an excessive fast heart rate that goes over 100 beats per minute in an adult. Bradycardia, a heart rate less than 60. Pulse rhythm. So pulse rhythm is a pattern of beats and the intervals between the beats. And dysrhythmia or arrhythmia, it is a pulse with an irregular rhythm. So let's start with the pulse taking. Okay, now the purpose of this assessment is to determine an adequacy of peripheral circulation or presence of pulse deficit. Okay, so before we start the procedure, we have firstly is to introduce ourselves to our client, and the reason or the rationale is to confirm the necessity, or just to make sure that we have the right client, or we're performing the vital signs taking to the right client. So hi ma'am, may I please have your name?
Ashley Chepe,
And can I please have your age, ma'am?
20.
Perfect. All right, so next is to explain what we're going to do and why it is necessary. So ma'am, what we're going to do now is we're going to take your pulse rate. Okay, so the rationale for that is to make the patient aware and comfortable. Now, next is to provide client privacy. So as I mentioned earlier, even though you are in the hospital setting, you still have to provide privacy to the patient. So don't expose too much, inside the clinic or in the ER or in the patient's bedroom or ward. So next is flex client's elbow and place the lower part of the arm across the chest. So let's just say that the patient is laying down. So this is what you're going to do. Now, let's pretend that she's laying down. So in order to take her pulse rate is we have to place our index finger and our middle finger on the inner aspects of the client's wrist. So it should be over the radial artery, and you have to apply light but firm pressure until pulse is palpated. So let's pretend that the patient is laying down. So this how your fingers should be placed. So this should touch the radial artery. So the radial artery is this part, and then the thumb, it should be on the outer part of the patient's wrist. And also you have to have, okay, just give me a moment. So you also have to have a watch with you. The watch that we will be using inside the hospital, or if we are getting the vital signs of the patient, should not be digital watch. It should be this type of watch, like the regular one. So while placing your index finger and middle finger onto the patient's radial artery, you have to um, count the pulse while looking at the movement of the watch. So it has to be like 1 minute. Now you have to identify the pulse rhythm and also the pulse volume. Now the rationale for this is to find the blood volume ejected against the arterial wall with each heart contraction. Now you have to count the pulse rate by using second hand on the watch in 1 full minute to get accuracy. So don't just guess, you have to refer to the second hand of the watch, and it should not be the digital watch. Now, after taking the pulse rate, you have to document, and again, it to the patient's chart. Now, the rationale is to make sure, or it's for easy retrieval and to provide an ongoing data collection for the patient. And so that the second nurse or the second physician who will provide care to the patient have a baseline data. So hi again. Now what we're going to do is to take the apical, or to locate the apical pulse of our client. Now, before we continue or before we do the procedure, we have to make sure that we have alcohol to disinfect our hand, and also before using the stethoscope, it has to be disinfected before it touches the patient's skin. So you have to disinfect it with alcohol using your wipes or cotton balls. Okay, and now next is make sure always and always explain what you're going to, or the procedure that you'll be doing to the patient. It's for proper communication, or to establish rapport and foster communication and understanding to the patient. So as I mentioned earlier, hand hygiene and clean the stethoscope. Then it is also very important to provide client privacy. So if you are, for example, we are in the, let's say, health center. So if there's a lot of people there and there's no bed, for the patient to lie down, always cover the area where the patient is. To provide privacy. So let's pretend that we are in the health center and there's a lot of people. Okay, so you have to close first the area where your patient is, or where you will be taking or getting the apical pulse. Now, as I mentioned, we have to clean the earpiece and diaphragm, right? And of the stethoscope using alcohol swab, or like if you have cotton balls or wipes. It's to reduce an infection and so that we don't, or we can't transmit any bacteria to the patient or infection to the patient. Now, what we're going to do next is to raise the client's gown to expose the sternum. So this is the sternum here. It's below our breast area, or below it is above a little your diaphragm, or close to your diaphragm. So because the patient is not wearing, or our client is not wearing gown, she's wearing a t-shirt, so just raise her shirt, and then the apical pulse is located in the fifth intercostal space of her rib. And the reason, or the rationale for that, is because the normal S1 and S2 are high pitch, and it's been heard with the diaphragm. So that's why we're placing the diaphragm on the fifth intercostal space of the patient. So it's right here. And then you have to inform the patient that you are going to listen to her heart and instruct her to remain silent. It's to get the client participation and to get the accurate um, pulse rate or the apical pulse rate of the patient. So with your dominant hand, put your earpiece on the stethoscope here and grasp the diaphragm of the stethoscope to the palm of your hand for 5 to 10 seconds. Then place the diaphragm of the stethoscope over the PMA, which is here. And auscultate the sounds for S1 and S2 to hear the lub dub sound or the heart sound. So the regionale is it's for the movement of the blood through the heart valve, and it creates S1 and S2 sounds. Now you have to note the regularity of the rhythm. So it is to establish or it is the establishment of the rhythmic patterns, and it determines the length of time to count the heartbeat and also to ensure accurate measurement of the apical pulse. So you have to start to count while looking at the second hand of your clock again. Where's my clock? It should be the second hand of your clock and not use digital clock. So you have to count the rate for a full 1 minute. Now it is to ensure sufficient time and to count irregular beats and to get an accurate data. So after that, you have to share your findings to your client. So it is to promote participation in care. So they have to be aware because patients have the right to know. Now, next is to record the findings. It's for to provide again ongoing data collection, and also for the next healthcare provider to have a like reference or like baseline data from your during your shift. So that's it. So next is respiration. Now, what is respiration? Respiration is the act of breathing. So inhalation or respiration or inspiration refers to the intake of air in the lungs. Exhalation or expiration refers to breathing out of the movement of gases from the lungs to the atmosphere. Now, ventilation is also used to refer to the movement of air in and out of the lungs. Eupnea it is a breathing that is normal in rate and depth. Bradypnea, abnormally slow respiration. Tachypnea or polypnea, it's fast respiration. Apnea is the absence of breathing. So the purpose of this assessment is to monitor the abnormal respiration and respiratory patterns and to identify changes on the patient's respiration. And next is to monitor respirations before or following the administration of general anesthetics or any medication that influences respiration. So third is to monitor clients at risk for respiratory alterations. Now, this assessment is to assess the skin and mucous membrane color. Let's say if it's cyanotic or pallor. Cyanotic is blue in color, like the patient becomes blue, and pallor is the patient's mouth becomes like white. And also it assesses the position assumed for breathing, and also to check for signs of cerebral anoxia or irritability, restlessness, drowsiness, or loss of consciousness. Now let us start with the vital signs taking for respiration. So, and again, let me do a recap. T is for temperature, P is for pulse, R is for respiration. So what we're doing now is the third part of, respiration, yeah. So what we're doing now is the third part of the vital signs taking. So you have to identify and introduce you have to introduce yourself first to the client, and also you have to make sure that you're identifying the client's name, her birth date. So hi ma'am, can I please have your name?
Ashley.
Hi Ashley, can I please have your date of birth?
29.
So from there, you have to check if you have the right patient chart. And the rationale for that is to make sure that you are performing the procedure to the right patient. Now, second is to explain what you're going to do and why it is necessary. So the reason is explaining the procedure to make the client feel comfortable and aware about her respirations, and also establish a rapport, and also to make him aware, because if she's not aware with the procedure, she'll feel conscious, and becoming conscious can or may alter her respiratory pattern. So third is you have to perform hand hygiene using the alcohol, and again to prevent the spread of microorganisms. Now you also have to provide clients privacy. So it is to make the patient feel comfortable. So you have to place the client's arm across the chest and observe the chest movement while supposedly taking the radial pulse. So it is to make the patient feel uncomfortable when you're taking the vital signs. So let's pretend that, can you move here a little bit, Ashley? So over here, so this is our patient, Ashley. So you have to pretend that you're taking the pulse rate of the patient. So after taking, because this is the position, right, when you're taking the pulse rate. So you have to place the client's arms across the chest and observe the chest movements while supposedly taking the radial pulse. And you have to start counting first the inspiration while looking at the second hand of the watch. So you have to pretend that you're taking the pulse, but actually you're looking at the patient's inspiration or the exhale. And then look at your watch, and then you have to observe the character of the respiration. If it's depth respiration, the rhythm of cycle, you have also to observe the character of the respiration. The respiration's characteristic gives additional data about alteration in respiratory status. Now, for example, Ash, can you put your hand here? So as you can see, her hand is positioned like this. But while her hand is positioning like this, you have to check the movement of her abdomen, while also checking the second hand of the clock for and counting her inspiration for a minute. So next is it is very important to record the rate and character of respiration. It is to maintain the legal record and to provide an ongoing data collection. Now, because we touched the patient, we have to do disinfection. So it's to prevent the spread of microorganisms and dirt. Like for example, our patient is a TB patient, and we are inside the TB ward. So because the patient has tuberculum, what's the name? Like the bacteria for tuberculosis? Yeah, something like that. Yeah, so you have to wash, especially if it's like a red room or like room for infections. So yeah, that's it, and thank you. So next is we will be taking the patient's BP or blood pressure. Now, a blood pressure is a measure of the pressure exerted by the blood as it flows through the arteries. It is measured in terms of millimeters, mercury, or mmHg. So there are four hemodynamic regulators for the blood pressure control: the blood volume, the volume of the blood in the circulatory system, the cardiac output. It is the major factor that influences systolic pressure. Systolic pressure is the first beats of that you will hear when you're taking the blood pressure. Now, peripheral vascular resistance, the size of the distensibility of the arteries, and viscosity or the thickness of the blood. So, taking the blood pressure, the purpose for this assessment is to obtain a baseline measure or data of the client's arterial blood pressure for subsequent evaluation. It is also to determine the client's hemodynamic status. So we also have to assess the signs and symptoms of hypertension, and also like let's say tachycardia, dizziness, and mental confusion or of the patient or the client. So the procedure before we will be doing the procedure is you have to introduce yourself to the client, and also you have to verify the client's identity. So hi ma'am, can I please have your name?
Ashley.
So get the patient's name, check your the patient's charts if it has the right name of the patient, and may I please have your age, ma'am?
20.
So get the age to make sure that it is the correct patient. Now some patients have the same name, so it is very important to identify the correct patient. And also you have to explain what you're going to do and why it is necessary. Now it is to provide information to the patient in a faster manner, and to provide understanding, and also in order for the patient to cooperate. So you have to perform the hand hygiene by using the alcohol again. It's to prevent the spread of infection or microorganisms, and provide privacy. So because we are in this position, it is still possible to take the vital signs or the blood pressure of the patient while the patient is sitting down. But you have to make sure that the arm will be placed in a flat surface. So position the patient appropriately, placed in sitting position unless otherwise it is specified. So this is a thin chair. So we have to find, for example, a pillow or something that, or a book, something that will support or can support the patient's arm, or to make sure that it is on the flat surface to get a proper data collection. So yes, slightly flex the elbow. Ensure that the patient is comfortable in his on her position. So these are the equipments that we'll be using: the SPIG nanometer and also the stethoscope. So make sure that the bladder cuff is fully deflated. So you have to make sure that it's fully deflated. So just squeeze the bladder cuff, and then locate the brachial artery in the antecubital space with your fingertips. So this one, the index finger and the middle finger. So this is her right arm. So you can locate it on her, on the left part of her right arm. Don't use your thumb, because thumb has different pulse rhythm because it's close to the um, radical pulse or radial pulse. So that's it. And then this one doesn't really have to be necessary on here. You can actually remove this, but this one is fine. So make sure that the bladder cuff is placed 2.5 centimeters or 1 inch above the antecubital space. So you can check it by using your thumb. Do it like this, so it's perfect. Now it is to placing the bladder cuff directly over the brachial arteries ensures proper compression of the artery during the cuff inflation. Now, the rationale why we have to palpate the brachial artery correctly is to make sure that we are placing the bladder cuff on the right position and also the stethoscope on the right position. Now, it is to identify approximately the pressure of the systolic and also determine the maximal inflation point and to get accurate reading to prevent oscillatory gap. Now, you have to inflate the cuff to 30 mmHg. And so let's do this. So don't hold it like this. You have to hold it like this. So place it. It has to be secured. Make sure that the bulb is not loosened. So you have to close this in order to inflate the bladder cuff. And slowly release or deflate the cuff. And after taking the blood pressure of the patient, so we just took the blood pressure of the patient. So after taking the blood pressure of the patient, you have to make sure. So we've already took the blood pressure of the patient using the bladder cuff and the stethoscope, right? So the way we took the blood pressure is we use our dominant hand to turn the valve clockwise to close. And the reason, so this is the valve of the cuff, so we have to close it. And in order, or the rationality is to ensure accurate assessment of the systolic blood pressure reading. Then once the bladder cuff is inflated, you have to release the valve of the cuff so that the pressure decreases to the rate of 2 to 3 mmHg per second. It is to prevent inaccurate measurement of occurring a deflation rate or too fast or too slow. So you have to be careful. And as the pressure falls, identify the manometer reading at carrot cuff face. It's to indicate the systolic pressure reading. You have to deflate the cuff rapidly, completely, to continuous cuff inhalation. It causes the arterial occlusation, resulting in numberless and tingling in client's arm. So remove, that's what we did earlier. We removed the cuff or wait 2 minutes before taking the second reading. if you feel that, or if you think that it's inaccurate. And then inform client regarding the reading. So you have to wait 2 minutes in order or to so that the client's arm won't experience any like bruising. And you have to inform the clients or the result of the reading. It's to promote participation, and so that the client is aware regarding her blood pressure. And again, you have to record the reading. It's to provide a baseline data, or like provide an ongoing data collection, and to maintain legal records on the client's or the patient's chart. And wash your hand or do the disinfection after doing or taking the client's blood pressure. That's it.